Good morning everyone. Slide discussion. Case number 6. History given to us was 30-year male presented with pain and swelling over vertebrae. In this image we can see a hypercellular lesion showing two varying sized cavities. The cavities lack an endothelial lining and the intervening stroma consists of numerous multinucleated giant cells and scattered spindle cells showing abundant amount of cytoplasm. So, the diagnosis was aneurysmal bone cyst. Coming to review of literature, bone cysts are fluid filled cavities with a connective tissue lining and varying number of septi. There are three important types of bone cyst and each contains a characteristic fluid. The first is the unicameral bone cyst, also known as a simple bone cyst. This type of cyst results from a temporary failure of bone formation during skeletal growth. The unicameral bone cyst usually has a single chamber and is filled with yellow serous like fluid. The second type of cyst, that is aneurysmal bone cyst, is thought by many to result from a focal hemodynamic alteration in normal bone, that is primary aneurysmal bone cyst, or in a pre-existing bone lesion, that is secondary aneurysmal bone cyst. An aneurysmal bone cyst contains many locus filled with the blood. The third type of cyst is the subchondral cyst. Cysts in this category include osteoarthritic cyst, intraosseous ganglia and post-traumatic cyst. Subchondral cysts occur adjacent to joints and contain mucoid or jelly-like material. Coming to aneurysmal bone cyst, it is seen usually in patients between 10 and 20 years of age and is slightly more common in females. It occurs mainly in the vertebrae and flat bones, but can also arise in the shaft of long bones. Multiple involvement is frequent in vertebral lesions. Exceptionally, a lesion with a feature of an osseous aneurysmal bone cyst is seen in a soft tissue location and even within the wall of major artery. Aneurysmal bone cyst is a destructive expansile bone lesion characterized by a reactive proliferation of connective tissue containing multiple blood filled cavities. The cyst may arise de novo in bone, that is primary, or in engrafted or pre-existing bone lesions, that is secondary, histologically identifiable in 30% of the cases. Grossly, it forms a spongy hemorrhagic mass covered by a thin shell of reactive bone which may extend into soft tissue as shown in image A. Radiographically, aneurysmal bone cyst shows eccentrical expansion of the bone with erosion and destruction of the cortex and a small peripheral area of periosteal new bone formation. Microscopy. The characteristic microscopic feature of aneurysmal bone cyst best seen on low power examination is multiple blood filled cavities of varying sizes. The cavities lack an endothelial lining and the stroma of the intervening septi consist of proliferating fibroblasts and scattered multinucleated giant cells. Reactive bone, usually in broad bands and fibromyxoid cartilage, are often abundant. The stromal cells sometimes show many mitotic figures. However, the stromal cells are uniform and atypical mitosis are not present. This is the microscopic image showing two cavities lined by osteoclast like multinucleated giant cells. The intervening stroma is a cellular but contains no neoplastic osteoid. Coming to differential diagnosis, solitary bone cyst. Solitary bone cyst usually occurs in long bones, most often in upper portion of the shaft of the humerus and femur. Microscopically well vascularized connective tissue, hemosiderin and cholesterol clefts are frequent. The bone surrounding the cyst may have a dense quality with irregular cement lines. Giant cell tumor. It consists of highly cellular lesion composed of large number of non-neoplastic osteoclast like giant cells between which mononuclear neoplastic cells are embedded. Telangiectatic osteosarcoma. It consists of multilocular tumor with large blood filled spaces along with high grade malignant cells in septi. These osteosarcomas are high grade intramedullary osteosarcomas which have undergone total or near total aneurysmal bone cyst like change. Thank you.